The COVID pandemic has challenged us and brought us together in ways we could never have imagined. And now, a year after all this began, there is an end in sight, a life-saving vaccine so that we can keep each other safe. Adults 70 and older have been hit hardest by this virus, and they are first in line to receive the vaccine. But many still haven't, and I wanted to know why and understand how we as a city can help. Out of an abundance of caution and to respect each organization's safety protocols, we held this virtual panel discussion. Hello, everyone. It's great to see you all, and thank you for taking the time for this very important conversation about your health and the health of our community. COVID has changed the way we do a lot of things every day. It has also had a devastating and isolating impact on our older adults. 80% of all COVID deaths are people 65 years or older. That is why this age group continues to be our nation's top priority when it comes to being vaccinated. We know that this virus is relentless and deadly, regardless of your age, gender, or zip code. We also know older adults who are already isolated by things like physical disabilities, lack of transportation, technology barriers, or illness, are often left behind or marginalized when it comes to critical information about their health and well-being. That gap is even greater when we talk about communities of color. We're going to do something about it, and we're going to do it right now. I've assembled an esteemed panel to help bridge the generation gap for all of us and empower us to support members of our community who are falling through the cracks. Our first panelist is Jayla Sanchez Warren. Jayla is Director of the Area Agency on Aging and the Denver Regional Council of Governments. She has 31 years of experience in the field of aging and has worked with Dr. Cog for 29 years. She has spent her career serving and advocating and planning for older adults. And we're also joined by Deidre Johnson. I've known Deidre for a long, long time. We worked together at the Urban League. Today, she is CEO and Executive Director of the Center for African American Health. Deidre is an Ascend Aspen Institute Colorado Children and Families Health and Human Services Fellow, a Transformative Leadership for Change Fellow, and a 2018 Livingston Fellow. She's just a fellow, a wonderful fellow. She also brings a personal perspective to our panel. I'm also proud to bring Roberto Ray. He is the Associate State Director, Multicultural Outreach at AARP Colorado. Proud to be a member, Roberto has been recognized statewide for his service to our aging population, a Distinguished Service Award for the Dr. Cog. And finally, we welcome Hillary Lum. She is a, get this, geriatrician. I had to work on that word there, Hillary, and a palliative care physician at the University of Colorado Anschutz Multidisciplinary Center on Aging. In addition to seeing patients, Dr. Lum is also an assistant professor of geriatric medicine. Her research focuses on developing and implementing effective models of care that integrate advanced care planning into the primary care system. So we're gonna get started. Each of our panelists will take a few minutes to share their unique insights on how we can better serve our aging population during this pandemic. Jayla, thank you for joining us. I'm so excited that you're here for this very, very important conversation. You know, the work that you do in addressing the issues of the aging community and, throughout Colorado is an important aspect for many of us who are caring for our parents, grandparents. We know how critical the work you're doing, how critical it is for us. How has the challenge of isolation contributed to the challenges of getting our older adults in our community vaccinated?
It is a big challenge. As you said in your opening remarks, a lot of the older adults have been impacted by this hard. And they listened to the governor and to everyone that said, stay home, stay safe. And so they did, but that meant sacrificing a lot of things, right? Sacrificing going out to their friends to see their friends. Some people didn't go to the doctor's office. Folks are not seeing their family members. And I think that's really difficult for people, and they're feeling isolated. Yeah, the AAA has been actively responding to the needs of older adults throughout the pandemic. We did, in the early days, food delivery, lots of food delivery, still continue to do that. Information assistance, it's changed, but people, I think we get information overload. We watch a lot of TV and get mixed messages, and people need to know where they can get services. We've done a lot of caregiver support, just like you said. There's a whole lot of family members that are taking on an additional caregiver role for their parents, but there's also grandparents raising grandchildren, and I think that's something that we sometimes forget. Imagine how challenging that is going to be, or that is, when kids are working virtually and you have to set up the computer for them, right? That can be really challenging. And then transportation is a big need in our community that we've been providing all the way through the pandemic. We provided medical trips, like to dialysis and cancer treatment, to important doctor's appointments. But now it's all about vaccines, and people who can't drive or don't feel comfortable drive needing to get to their vaccines on a specific time. And that's been a very big challenge. This program is so important because this population is most at risk. And there's a lot of, we're talking to people and we're asking them about whether they want to get vaccines or not. And some thousands are saying yes. And they're saying, yes, absolutely. I want to feel protected. I want to get back to my normal life. I want to see my family. I don't want to be afraid anymore. And some actually need to work. Social Security, if you just have Social Security income, you need to supplement that. But then there are other people that say, I'm nervous about the vaccine. I'm not really sure. I don't think they've done enough research. I have a lot of health issues, and I'm concerned that it might impact the other medications that I take. There's a lot of distrust of the government. It's out there. People don't know what the long-term effects will be. And so they're afraid. They're just plain afraid. Yeah. There are a lot of barriers to getting the vaccine. And I think it's important for us to understand. First, information overload. Oh my goodness. You hear it every 2 minutes, it feels like, on the TV. I talked to a person, she said, I got online. There was so much coming at me, I couldn't even sort through it. And imagine that. There's shortage of vaccines. So people are all excited. My colleagues across the state, they were all geared up, ready to have a vaccine event. And then they only got 100 vaccines. That was disappointing. Problems with technology. A lot of people are not connected to the internet, don't use it, don't have a smartphone, don't have connectivity. That's been a problem. Transportation. Right. And then there are some people that are really homebound and cannot go to a vaccine site. And so we really have to work on helping those folks. There's a lot of resources out there. I think you'll be showing some later on in the program, but reach out. If you need help finding a vaccination, if you need to test, you know what, we're still going to have to test, even if we get our vaccine. My staff are getting vaccinated. Before they go out and do in-home visits, they're going to have to test, because you can still carry it in your nasal passages. If you need help with other resources or transportation, call the Area Agency on Aging. We can help you out.
Thank you, Jayla. Very good. Deidre Johnson, I'm going to get you in here. And first of all, thank you for joining us as well. Jayla mentioned barriers, and as the leader of the Center for African American Health, you certainly are facing and dealing with, the barriers that African Americans face every day, particularly when it comes to their health. And one of those barriers is distrust in the healthcare system. And one of the motivators for us to do this series was people of color weren't stepping up and saying, I want to take this vaccine. Can you talk a little bit about how, particularly older African Americans who may have a more clear memory of the Tuskegee experiment and understanding what happened and the devastation in that community and the pain so many of us felt and have experienced such discrimination, how we can help that community and that demographic begin to overcome, and the importance of taking this vaccine.
You know, it's interesting. Very true with regard to the historical mistrust we have. But, you know, I have to say, when we look at vaccines in general, the best numbers I've ever seen for the white community is no more than 59%. So nobody's run into vaccines historically. However, we're the one group that has historic reasons for really distrusting the medical system because of different atrocities. One of the things we've been trying to do is give people as much information as possible. I liken it to, because of history, because of people's current day running into biases within the healthcare system, there's a haze around this. And so anything we can do to kind of clear that haze so people can make the best decisions for their family is what we're trying to do. And so as much information we can, but we've also, so we've moved into our own building. We have been using that kind of for COVID response. We've been offering COVID testing, so we have standard dates. Flu vaccination, we did that because we just wanted to start that discussion about, you know, vaccinations are important, this is important. And even with regard to the COVID vaccine, we're about to hold our first event on Friday. I'm very clear to let people know, here's what it is and here's what it's not. It's not a silver bullet. Like was mentioned earlier, you might still get it, but it prevents death. And when you look at the disparities, we are more likely to be infected, more likely to be hospitalized, and we are dying the most across the nation. Last time I checked, it was 4 times as much as far as the death rate. And so I think just letting people understand, we don't know everything right now, but we know the efficacy of this and that it's safe. And how can we help remove the barriers to get to it? Because that's been the hardest thing. Because to be honest, I've been receiving calls since December from seniors or ran into folks in King Soopers, Deidre, how soon can you help me get this vaccine? And so there's a desire to have it. There'll always be some folks that need more information.
Yeah, I appreciate that. Keep going. I mean, because I'll come back to you in just a moment because I think I want to explore a little more. How do we equip the community with the tools to help inspire, to break down the barriers of fear and distrust as we advance, and help get mom and grandma and Miss Jones down the street and Mr. Jackson, you know, saying, "Hey, I'll take the vaccine." Let me bring Roberto Ray. Go ahead. I'm sorry. You want to say something?
Well, 2 things along that line. About information, like one of the first things we assume was, wait a minute, if we had trials, we're typically not included. So finding out that not only were we included, but there were Black doctors involved. We've been doing Facebook lunch and learns, and I had a wonderful conversation last month with a doctor who was in the trials, and for an hour he just took questions from community. And that's the thing. Ask any question, anything to make folks feel that they understand what this is, what this isn't, so they can make the best decision.
I appreciate that. I can't wait to explore that a little more. We bring Roberto Ray with AARP. I'm a proud member. I got to tell you, you know, I remember being 30 going, I can't believe I'll ever be a member of AARP, but here I am. I carry my card. Roberto, thank you for being here with us. And can you talk a little about what, you know, the nation's largest older adult association is doing to help encourage folks to get this vaccine and begin to break down some of these barriers?
Certainly. We have a significant number of members in Colorado, in the Denver metro area. We have about 20,000 Hispanic members, 8,000 African American members, and significant members in the Asian Pacific and Indian community. And we're able to reach out to them by mail, email, and we've been doing that. We've done a number of webinars, and to reinforce what Jayla and Deidre have mentioned, there is a significant amount of education that's going to have to be done because a significant number of people either indicate that they are not going to get the vaccine, maybe 25% of in some polls that we've done of our members, or that they want to get more information. So it's going to call for a concerted effort on all of our parts to reach out to them. We know that people like to hear and trust information from people in their community, and are willing and trying to work to recruit our members as volunteers to work in their community, to talk to their family, to their neighbors, and provide information on the importance of getting vaccinated. You know, there are some special communities, in particular the immigrant community, that face special hurdles. There's fear in the community that in some cases, the misperception that if they get the vaccine, they may have issues later on getting a green card or have issues with immigration. So there's a lot of education that needs to be done, in particular to the Hispanic immigrant community.
Thank you, Roberto. We look forward to engaging you more in this conversation as we bring in Dr. Lum. And Dr. Lum, thank you so much for being here. And let me just say that UC Health has been one of the institutions in our state that has just gone above and beyond and making sure that people have access to this vaccine and doing what's necessary to set up sites for people to get the shot in their arm and get going. So thank you and UC Health for all that you're doing. So this is your chance. We've been talking about barriers. And you, being the medical professional on this call, you know, the stat that I laid out at the beginning of this is that 80% of all deaths are people 65 years or older. And of course, the barrier is we don't know if it's safe. We don't trust that it's safe. And unfortunately, the onset of the development of this vaccine was entitled Operation Warp Speed, which gave everyone the impressions that corners were being cut, protocols were being dismissed or leaped over, and here comes this vaccine into the market that may not be safe. Can you talk a little bit about the development of this vaccine, the protocols that were in place, the trials, and convince everyone that this is a safe vaccine?
Thank you so much for having me. It's great to be here in partnership. As a scientist and a doctor, this amazing past year of partnership between scientists and public health agencies as well as pharmaceutical companies has been very rigorous and has been very evidence-based. And I think the vaccine is safe and now it's available because no corners were cut. Processes were done simultaneously, which I think is the key difference in terms of why we can have vaccine being delivered on a daily and weekly basis here for Coloradans. So it's been terrific to see how we can now be working to get shots into arms, and especially for our most vulnerable populations. We've loved partnering with many organizations, and at Seniors Clinic, we have really worked to be the extra layer of support to overcome that information overload, to ask if individuals, our patients, have questions about the vaccine, to give them straightforward answers when they do have concerns. And we've really appreciated how many seniors are actually interested in getting the vaccine. When we started back in early January with the ability to vaccinate individuals over age 70, we knew that less than 5% of our immigrant population and only 8% of our persons of color within our clinic were vaccinated, whereas the total was 20%. Now, 6 weeks in, because we have made specific phone call outreach to ask if our populations are interested in the vaccine, we've increased our overall rate to 56%, and specifically our persons of color rate to be 45%, and our immigrant population to be 40%. It's been a specific emphasis of ours to really mobilize our students from nursing, pharmacy, and medical background to be doing one-on-one calls, just like AARP, trying to engage volunteers. So in this case, students as volunteers. We've really found it to be very meaningful work.
Yeah, I appreciate that. Dr. Lum, let me ask you a question as we start this Q&A phase with the panel. I wonder, do you know what the percent of our community or just general population actually take the flu vaccine?
Oh, that's a good question. You know, I think nationally, we often are aware of about 50%, 50 to 60% of people get a flu vaccine. Incidentally, this past year, especially among older adults, there's been lots of uptake of the flu vaccine and pneumonia vaccine and shingles. So at least in the older adults that compared to perhaps other age demographics, there's been such eagerness for vaccination while waiting for the COVID vaccine.
I appreciate that. And there's a reason why I asked that question, because I wonder if people's status quo thoughts around taking the flu vaccine impeded our ability to encourage folks to take this vaccine. And what I mean by that, particularly our older adults, I don't ever take the flu vaccine. I don't get sick, so I ain't gonna have to worry about taking this one. And I'll be okay. I remember, and I open this up to the panel about what we need to do to begin to break down some of these barriers. I would love some of your individual thoughts. And I'll take it from, share my personal experience. You know, I took personal interest in making, leadership and making sure my mother got vaccinated. My wife did the same thing with her mother. Both of our parents, our mothers are in their 80s. And I remember calling my mom saying, hey, listen, your doctor called and you're up to get the vaccine this weekend. And she says, I'm not ready to get a vaccine. I got this medicine I'm taking. I said, listen, your doctor would have never called knowing what medicine you're on if he thought this would be a problem. And she said, well, I'll wait. I said, listen, if I have to come and throw you over my shoulder, carry you personally to get this vaccine, you're going. And so I'm just curious. I'm gonna open up to the whole panel. I would love to hear your thoughts and maybe personal anecdotes about what we need to do to encourage more of our 65-year and older friends, family members, neighbors to get vaccinated. Because I do think it takes some personal engagement from those of us who maybe are not up yet for the vaccine to make sure they get vaccinated. Jayla, you have any thoughts?
I think you're right. That personal connection makes a big difference, right? I've talked to people who said, I'm just going to wait and see what happens to my friends who get it.
Yeah.
You know, and that talking about it, I think being honest, you have to be honest, you know, and tell people what you know. Get as a leader in the community, I think it's really important that we get as much information as we can and stay abreast of all the new information so that we can provide good quality information to people, because that trust is important.
Yeah.
And then make it as easy as possible. Make the phone call with them. In our office, I tell people if they're nervous and they want your help, make it with them. To help do whatever you can just to facilitate that. And I think that's what we tell family members too. Sit down, make the call together, figure out a good time. I know it is difficult. My mom couldn't wait to get it. And then my stepdad, he didn't want it. He didn't want to do it. And it was quite I had to talk a lot to him to get it.
And you got to have that relationship, very personal one. But Deidre, in your capacity, if you're running an association that is focused on African American health, help give us the tools. I mean, as an African American, what do I say to an African American older adult who maybe says, my history is too fresh with this sort of thing? How do I help break down that barrier with them? You say raise awareness. How do I do that?
It's kind of both and. It's interesting because I agree with what Jayla's saying. It's those trusted messengers. And so we've been working with Dr. Terry Richardson, Dr. Oswaldo Granardo, folks who just have name recognition of being in our community and being supportive. As a leader of an organization, because early on I was on the fence. I'm like, I need to know a little bit more. And I had promised I will not encourage others unless I myself am ready.
Right.
But part of it was there was so much happening. Every day there was new information. One of the things we're doing while we're still trying to make things easily available is we're working with some researchers to come up with our own culturally relevant marketing. And we're just going to test different messages because this is going to go on for a while. So how can we get the folks who are really staunch, I'm never going to get this done? I think one challenge has been the accessibility of it, because right now we've got these big events happening. When we even knew through the COVID testing, it's more effective to reach diverse communities if you make them small community events, so it's easy access. My mom's a retired nurse, so she's been vaccinated. I have, because at least the first part, because of being in the response space. But the other part is, yes, a lot of things have happened, and yes, there are multiple things that have been done to us. But even the Tuskegee it's like a false comparison, because in that comparison you had men who had syphilis and they were denied treatment. Where here, there's something that is killing us. And early on, I was, just watching things. I've lost multiple family members, mostly men on the East Coast.
I was going to ask you to talk about that because I think, does this give, obviously, will give all of us a greater motivation to kind of engage and express the importance of taking this vaccine?
Yeah, I had, and one of my cousins couldn't, he worked in construction and he was self-employed, so he couldn't stay at home. And he was in Philadelphia, and within 48 hours of being in the hospital, he was gone.
Wow.
And his brother was telling us, hey, the CDC was there. This was COVID. Despite that, I've got some other folks in my family who are like, I still don't know. And so all I can do is my best to give them as much information as that I know. And so I think it's for those who are willing, connect them to the vaccine as soon as possible. And the others, we just keep repeating that message. Because even if you're selling somebody a car, it takes 7 times. So that's why I've been telling people, let's start now. We were trying to start talking about the vaccine in the summer, in the late fall, because we knew, it won't be available widely until next spring, but we need to till the ground now so people even think about it. And so I'm pleased, but we've got a lot of work to do, but we're ready, and we're just going to keep plugging away.
Absolutely. Roberto, you all at AARP find that your collateral material has, or at least you're getting response from your members in terms of seeking information about the vaccine and accessibility to it?
Yes, it is. Especially being able to reach out to people via mailings has an impact. Just to reinforce the fact that a lot of people don't have the computer technology access that others do, and to reinforce the importance of people in the community reaching out to their neighbors and other community members, respected, in addition to medical professionals, entertainers. If an entertainer gets the shot, I think that'll have an impact. I believe the neighborhood vaccination sites that you are opening up are a tremendous step forward. Having a place that people know that they can go to in their neighborhood, and that groups like ours and other grassroots groups can use to inform people in those communities. This is where you can go.
Thank you for saying that, because those fixed sites, as Deidre alluded to, make a difference in our communities. Once we left or closed down the big testing site at the Pepsi Center, we saw greater efficacy or reach with communities of color in particular when we moved into the communities and brought testing to them, and we continue that today. So it does make a huge difference. We don't have much more time left, but I want to get to Jayla real quick, and one last question for Dr. Lum. Jayla, there's transportation available for our older adults who may have access challenges to the vaccine?
There is. We've been partnering, DRCOG funds a number of transportation, 7 different transportation companies, and we've been providing free trips, and they'll even wait there with you, right? Because we got to wait that 15 minutes. So you don't have to be sitting there for a long time, and free trips and free ride home. And it's been pretty smooth. We did the big SCL event at the stock show grounds. Wow, that was huge.
I was there.
And transported, and transported about 350 people there through our transportation provider. So yeah, you can call your health network. They can set up a ride for you, or you can call DRCOG and we can help you set up a ride. Don't let transportation be a barrier, please, because there are ways to get you there and home safely.
Thank you, Jayla. And Dr. Lum, the last question is for you. Everyone's talked about the side effects of taking the vaccine, and we've heard the gamut. The first shot, people were either fine or it was bad, sore arm. Second vaccine, maybe some flu-like symptoms. Can you talk about that for a while? And what I noticed with my mother is that it didn't last very long. She said one day after the first shot, no problem. Second shot, that day she felt crummy, or the day after she felt crummy. and then she was fine. But there are side effects. Can you talk a little bit about those?
Well, you just did my job, because what I would say when I talk with patients and their families is exactly what you just said. And it's actually so helpful to hear someone else's experience, because it isn't in the medical jargon. So I agree with your mother's experience that for some individuals, they may have a sore arm. And in the study, that was a pretty high percentage of people, 60 or 75% had one symptom, like a sore arm being the most common. And then we have, as a community in Colorado, seen that the second shot often had more of an immune response, which for some people felt like mild flu-like symptoms. Might be feeling more tired, a headache, just not feeling their 100% self. And I've heard from many people, it's lasted about a day, day and a half. Everyone is different. So it's been so good to hear different people's reactions, that they heard, well, their neighbor or their friend or their family member had this pretty easy experience of it, and that encouraged them to come in and get the vaccine. So I really appreciate the leadership of our older adults who have gone first and gotten the vaccines and are actually sharing it in their families. I have deep appreciation for families who are sometimes providing that transportation, even though they themselves may not be ready for it yet, and once it becomes available, and yet they'll be able to point to the fact that their older adult family member got the vaccine, and that might actually encourage all ages to be vaccinated, which is ultimately what I hope for.
Yeah, we all do. Listen, Dr. Hillary Lum, Roberto Ray, Dieter Johnson, Jayla Sanchez Warren, I can't thank you all enough for doing this with us, and I truly, truly appreciate it. I know the community does as well. We are getting tremendous response from these panels, and hopefully it makes a difference. Encourages at least one person to go and get the vaccine in their arm. Thank you all.
Hey, I want to again thank the incredible panel of experts who joined me for this important conversation, and our partners at Rocky Mountain Public Media for helping us reach as many of you as we can. And thank you for continuing to wear your mask, socially distance, and avoid gathering with people outside your households. Together, we will move from rescue to recovery.